From a kids show trading in fart jokes and construction paper cutouts, to a program doctors online have described as closer to a documentary than satire. Most people call South Park's healthcare episodes exaggeration for laughs. Physicians who actually work inside that system keep saying otherwise. This is South Park versus the American healthcare system. The 29-year pattern. South Park started in 1997. By the time this video was made, the show had been running for 29 years. In that stretch of time, the four boys of a small Colorado town have been dropped into almost every corner of American life that a person can think of. Politics, religion, technology, celebrity culture, but one target keeps showing up again and again in almost every era of the show, under almost every version of Trey Parker and Matt Stone as writers. That target is the American health system. Not just doctors, not just hospitals, the whole machine. The drug companies that make the medicine, the insurance companies that decide who gets to have it, the food companies that profit when people get sick in the first place, and the government agencies that are supposed to referee all of it, but often just add more paperwork. This is not a small detail buried in a handful of episodes. It is closer to a second show running quietly underneath the main one. Every few years, sometimes every few months, South Park returns to this subject and takes another swing at it. The jokes change, the targets shift depending on what is happening in the news that year, but the basic idea never really goes away. Somebody in South Park gets sick, or gets labeled as sick, and then has to deal with a system built around that sickness. What happens next is rarely simple and almost never kind. The reason this pattern matters is that it did not happen by accident. A comedy show could easily avoid a topic like healthcare. It is not the easiest subject to make funny. Insurance forms and drug pricing do not sound like material for jokes on the surface. But South Park kept going back to it anyway, decade after decade, long before healthcare became one of the most argued about topics in the country. That kind of consistency is worth paying attention to. When a show returns to the same target for almost 3 decades, across different presidents, different healthcare laws, and different generations of viewers, it usually means the writers see something there that they think is worth repeating. To understand how deep this pattern runs, it helps to walk through it in order, starting near the very beginning of the show and moving forward in time. In the earliest years of South Park, back in the late 1990s, the show already had its eye on the culture around weight, appearance, and quick fixes for the body. One of the first season episodes shows Cartman getting involved with a product built around the idea of rapid weight gain, tied to a contest and a prize he wants badly enough to eat something he probably should not. It is a simple joke on the surface, a boy doing something extreme to win a prize, but underneath it is an early version of a question the show would return to again and again over the following decades. What happens when people are offered a fast, dramatic solution to a problem with their body, and what happens to the people who sell them that solution? A few years later, in the show's 4th season, South Park introduced a plotline about a boy who is taken to the doctor and diagnosed with attention deficit disorder. He is prescribed a medication called Ritalin. This episode matters for a specific reason. It is one of the first times the show pointed its jokes directly at the medical system itself, rather than just at the person who is sick. The joke was not really about the boy. It was about how quickly and easily a diagnosis could be handed out, and how quickly a prescription could follow it. The town's pharmacy became a recurring location in the show from that point forward, showing up in later episodes as a place where medicine gets handed out for all kinds of reasons, some more serious than others. That pharmacy would go on to appear in stories about morning after pills, condoms, and even a pharmacist who ends up arrested for illegally supplying kids and adults with cough medicine so they could get high off it. Each of these moments is small on its own. Together, they form a pattern. Medicine in South Park is rarely shown as something simple. It almost always comes wrapped in some kind of system, some kind of decision being made by an adult in charge, and that decision is not always a good one. By the mid-2000s, the show had shifted some of its attention toward a different part of the health conversation, the world of elective procedures and the culture of appearance. An episode from 2007 pokes fun at the public's obsession with celebrities and their bodies, including the growing trend of cosmetic medical procedures done not because someone is sick, but because of vanity and image. This is an important shift to notice. The show was no longer just asking questions about sickness and medicine in the traditional sense. It was starting to ask questions about why people go to doctors at all, and how much of that decision is shaped by pressure from the outside world rather than an actual medical need. The year 2010 turned out to be a especially busy one for this pattern. 2 episodes that year pushed the show's healthcare satire in very different directions, and both are worth knowing about because later sections of this video will return to them in much more detail. The first is called Medicinal Fried Chicken. This episode takes aim at the world of medical marijuana, at the time a newly legal and rapidly growing industry in parts of the United States. The episode blends this subject with jokes about video game addiction, social media, and fast food, tying several different modern habits together under one roof. The core joke running through the episode is about how a substance can be treated as medicine in one context and as something illegal or dangerous in another, depending entirely on how it gets labeled and who is doing the labeling. The second 2010 episode is called Sexual Healing, and it takes the idea of labeling even further. Following a real news story involving golf star Tiger Woods and his very public affair scandal, the episode imagines a version of America where scientists at the Centers for Disease Control decide that sex addiction has become a real disease, spreading through the population at what they call an epidemic level. Schools begin testing children for it. Some of the boys from South Park Elementary are diagnosed. One of them ends up in a rehab center alongside a group of famous men who have also been caught cheating on their partners. What makes this episode stand out is not just the joke about celebrities behaving badly. It is the deeper question buried inside it, about how quickly a system can turn ordinary human behavior into an official medical condition when there is enough public pressure, enough embarrassment, and enough money to be made from treatment. This idea, a system turning something ordinary into something official and profitable, would end up being one of the clearest threads running through the show's entire healthcare pattern. Moving into the 2014 season, the show turned its attention toward government food policy with an episode called Flip the Pyramid. This one takes aim at federal guidelines about what Americans should be eating, mocking how those guidelines get created and how much influence outside industries have over them. This episode is a smaller entry in the overall pattern, but it matters because it shows the show was not only interested in doctors, drugs, and insurance companies, it was also willing to look at the government itself as part of the health system, and to question whether the official advice being handed down to families was really built with their health in mind, or with something else in mind entirely. In 2017, South Park released one of its most pointed and least jokey entries in this entire pattern, an episode called Hummels and Heroin. On the surface, the episode is about a strange smuggling operation involving painkillers hidden inside collectible children's figurines and stuffed mascot costumes. But underneath the absurd plot, the episode is doing something the show rarely does this directly. It is placing blame, real blame, aimed at real causes. The episode points at pharmaceutical companies as the first and biggest reason the opioid crisis in America became as severe as it did, and points at doctors as a second contributing cause for going along with the pressure those companies put on them to keep prescribing. This episode will be covered in much greater depth later in this video, but it deserves mention here because of how clearly it shows the show was willing to step outside pure comedy and make a direct argument about who was responsible for a national tragedy that, by that point, had already killed hundreds of thousands of Americans. 2 years later, in 2019, the show returned to a much stranger and more physical kind of health story with an episode called Turd Burglars. This episode centers on a treatment called a fecal transplant, a real medical procedure used to fight a serious bacterial infection called C. difficile. Kyle's mother undergoes the treatment in the episode, and the plot spirals from there into one of the show's more chaotic and gross storylines. On the surface, this looks like nothing more than a gross-out joke, the kind South Park has always been known for. But it fits the larger pattern too, because it shows the writers reaching for real, sometimes obscure corners of modern medicine and turning them into material, rather than sticking to the more obvious targets like insurance companies or drug ads. It shows a willingness to follow wherever medical news actually goes, even into strange and uncomfortable territory most comedy writers would avoid entirely. Then came 2020, a year that changed the subject of health and medicine for the entire world, not just for South Park. The COVID-19 pandemic reached the United States early that year, and by September, the show had already produced a full hour-long special built entirely around it, called the Pandemic Special. This episode covers an enormous amount of ground in a very short amount of time, touching on face masks being worn incorrectly, schools trying to figure out how to reopen safely, police funding being pulled and then restored, and one family's story tangled up in guilt over how the virus may have started. This episode will get its own detailed section later in this video, but it belongs here in the timeline because of how quickly the show responded. Most television takes months or years to catch up to a moment this large. South Park turned it around in a matter of months, while the pandemic itself was still unfolding in real time. The following year, in March of 2021, the show released a follow-up special called South Park Vaccination Special, focused on the early rollout of COVID-19 vaccines across the country. This episode captures a very specific and very real moment in American history, when vaccines were still limited in supply and were being given first to older adults and essential workers, while everyone else waited their turn, sometimes standing in long lines outside pharmacies pharmacies hoping to get a dose. The episode also weaves in a storyline about conspiracy theories spreading through the town, mirroring the very real spread of vaccine misinformation happening across the country at that exact time. Like the pandemic special before it, this episode will be explored in far more detail later in this video, but its place in the timeline matters because it shows the show tracking not just the virus itself, but the entire messy process of trying to end it, including all the confusion, all the mistrust, and all the uneven access that came with that process. Finally, in May of 2024, the show released what may be its most complete and most direct healthcare episode yet, a special called The End of Obesity. This episode ties together nearly every thread this section has already walked through: pharmaceutical companies, insurance companies, the food industry, government policy. All of them appear in this single episode, all pointed at once, through the story of a boy who needs a weight loss medication his insurance will not cover. This special is important enough to this video that it will be the subject of most of the sections that follow, because it is the clearest and most complete version of the argument South Park has been building since the very first weight-related jokes back in the show's first season. Looking at this timeline all at once, from 1997 through 2024, a certain shape starts to appear. It is not a straight line. The show did not set out with a plan to build one long argument about healthcare over 27 years. But looking back, the pattern is hard to miss. Almost every major era of American health news found its way into the show eventually. Attention deficit diagnoses in children during the early 2000s, medical marijuana as it spread state by state, sex addiction as a media spectacle following celebrity scandals, government food guidelines and who really writes them, the opioid crisis and who profited from it, strange but real medical procedures most people had never heard of, a global pandemic tracked almost as it happened, a vaccine rollout captured in real time, and finally, an entire special dedicated to weight loss drugs, insurance denial, and the tangled relationship between the companies that are supposed to be keeping Americans healthy. What makes this even more notable is who was doing the writing the entire time. Trey Parker and Matt Stone have remained the driving creative force behind South Park for its entire run. This is not a case of different writing staff stumbling onto the same topic by coincidence decade after decade. It is the same two people returning to the same general subject over and over across almost 30 years of their working lives. That kind of long-term focus rarely happens by accident. It usually means something about the subject keeps pulling them back. There is also something worth noticing about how the target keeps shifting even while the general subject stays the same. In the earliest years, the jokes were mostly aimed at individual choices: a boy eating something strange to win a contest, a kid getting a quick diagnosis and a pill. As the show matured, the jokes started aiming higher, at entire industries and entire systems: pharmaceutical companies, insurance companies, government agencies, food manufacturers. This shift matters because it mirrors something that happened in real American life over that same period. Public conversation about health slowly moved away from just blaming individuals for their choices and moved toward asking harder questions about the system surrounding those choices, the companies profiting from sickness, and the policies making treatment harder to reach. South Park's jokes moved in that same direction, almost exactly in step with the culture around it. This section exists to set the stage for everything that follows. The rest of this video is going to slow down and look closely at a handful of these episodes, especially The End of Obesity, the pandemic special, the vaccination special, and Hummels and Heroin, pulling apart exactly what each one says about American healthcare and how closely those jokes match real events, real numbers, and real complaints from real doctors and patients. But none of those deeper sections would mean as much without first understanding that this is not a show taking one isolated shot at a topic that happened to be in the news. This is a show that has been circling this exact subject for almost its entire existence, coming back to it again and again, sharpening its aim a little more each time. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. The next place this video goes is straight into the heart of that sharpest aim. The sequence inside The End of Obesity where three boys try to do something that sounds simple on paper: get an insurance company to pay for medicine a doctor has already said one of them needs. What happens to them next turns into one of the most accurate pieces of comedy about the American insurance system that has ever aired on television, and it is where this video picks up next. Section 2. Navigate the American healthcare system. There is a sequence inside a 2024 special called The End of Obesity that has become one of the most talked about pieces of comedy about American medicine that has ever aired on television. Almost every frame of it lines up with something a real person navigating real health insurance in America would recognize, and it is worth walking through slowly, piece by piece, because the accuracy of it is what makes it land. Before getting into the insurance insurance office itself, it helps to understand how the boys end up there in the first place. The special opens with Eric Cartman being told by a doctor that his weight has become a serious risk to his health. His mother, Leanne, pushes back a little, saying that diet and exercise have already been tried and have not worked. The doctor then brings up a newer option, a medicine originally made for diabetes that has also been shown to help people lose weight. This medicine is never treated as some made-up cartoon invention. It is a real category of drug that had become one of the biggest stories in American medicine around the time this special was written, and the show treats it that way from the very first scene. The problem is not whether the medicine works. The problem shows up almost immediately after that, the moment money enters the conversation. Leanne cannot afford it without help, and the family's insurance will only pay for the drug if Cartman has been diagnosed with diabetes, which he has not. He simply does not qualify, even though a doctor in the same room has just told him he needs it. This is the exact moment the special turns from being a story about one boy's health into a story about an entire system built around deciding who gets to be healthy and who does not. Cartman is heartbroken, not just about his weight, but about being told no by something that is not even a person. A company decided he does not fit the right box. That single moment sets the entire rest of the plot into motion, and it is worth sitting with for a second, because this is not a joke about laziness or bad choices. It is a joke about paperwork standing between a sick person and the medicine a doctor already recommended. Kyle is the one who cannot let this go. Even though Kyle and Cartman spend most of the show fighting with each other, Kyle is disturbed enough by what has happened that he decides to help. This decision matters for the story because it puts one of the show's most stubborn and most morally driven characters directly inside the machine the episode is about to describe. Kyle is someone who usually wants to do the right thing and expects the world around him to eventually agree with him if he just explains himself clearly enough. That personality is about to run straight into a system that does not care how clearly anyone explains themselves. Kyle, Cartman, and Butters set out together to try to get the insurance company to pay for the medicine. This is the beginning of the sequence that gives this section its name, a part of the episode built around a song called Navigate the American Healthcare System. Before getting into the song itself, it is worth walking through what the boys actually walk into when they first arrive at the insurance company. They enter a large office building. A man in a suit greets them at the front, sounding excited and helpful, asking if they are there to sign up for insurance. This detail matters more than it might seem. The man's excitement is not fake exactly, but it is aimed entirely in one direction. He lights up at the idea of new customers. The boys quickly correct him. They are not there to sign up for anything. They are there because a claim needs to be paid, because medicine has already been prescribed and now needs to actually be covered. The moment the conversation shifts from signing up to asking for something back, the man's energy changes completely. Instead of helping them himself, he sends them further into the building, away from the bright, welcoming front area and into somewhere much smaller and much less pleasant. That somewhere is a cramped, dim office in the back of the building. Inside sits an older man at a plain desk, surrounded by filing cabinets stuffed with paper, stacks of open claims piled high around him, with barely any space to move. He is not using a computer to look anything up. He is using a manual typewriter. When it comes time to make a decision about the boy's claim, he does not send an email or check a system. He picks up a rotary phone, the kind with a dial instead of buttons, and calls the company's medical director to ask whether the claim should be approved. The answer comes back almost immediately. It is a no. There is no real explanation given beyond the fact that it is a no. When the boys press for a reason, the old clerk explains something to them plainly, almost like he is tired of having to say it out loud again. He tells them that the medical director's entire job is to say no, not to review cases carefully, not to weigh evidence. His job, as this man describes it, is simply to deny things. This single line does more work than almost anything else in the special. It is delivered without much drama, almost as a shrug, like it is just how things work and everyone in the building already knows it. That flat delivery is part of what makes it land so hard. Nobody in the scene treats it like shocking new information. It is treated like something old and familiar, something the clerk has clearly explained many times before to many other confused, hopeful people standing exactly where the boys are standing now. From here, the boys do not just walk away. They keep trying because Kyle in particular refuses to accept that this is really the end of it. And this is where the episode shifts into its song, Navigate the American Healthcare System, which turns the entire process into an upbeat, almost cheerful sounding tune that describes the exact opposite of anything cheerful. The song follows the boys as they are bounced from place to place. A secretary at one office tells them to just fill out some forms. Kyle points out that they already filled out identical forms at the last place, but that does not matter. They have have to do it again. A doctor tells them he cannot sign off on something for insurance purposes because it needs to be signed by Cartman's original doctor instead, sending them back to where they already came from. They go back to the doctor to get something for insurance, then back to insurance, only to be met with silence, and then told they need a second opinion from a doctor who is in their insurance network specifically, not just any doctor. Another secretary tells them the paperwork needs to be filled out again and then faxed over to the insurance company. So they fill it out, they scan it, they email it, and after all of that, there is more silence, followed by yet another message saying they need confirmation from a completely different specialist this time. At one point in the song, Kyle gets frustrated enough to say they already spoke to the insurance company directly, and that this same insurance company was supposed to be the one contacting the doctor, not the other way around. Nobody on the other end seems to know or care that this conversation already happened. The song keeps circling back to its main phrase, describing this entire mess as navigating the American healthcare system, sung in a tone that almost sounds like a jingle for something you would want to sign up for, even while the words describe exactly the opposite. The chorus repeats the idea that this is happening for the person's benefit, that it will make them healthier and stronger, even as every single verse shows the opposite happening in practice. The lyrics eventually walk the boys through an entire loop. They go back to the doctor, then back to the specialist. The specialist talks to the insurance company. The insurance company then faxes a document to something called the medical advisor. And the medical advisor, the person whose decision this whole loop has been building toward, turns out to be somewhere on a boat, far away, seemingly unreachable in any normal sense, and the answer that eventually comes back is simply no, with no further explanation offered. This loop is not treated as a one-time inconvenience in the episode. It is drawn out, verse after verse, showing the same basic motion over and over, with slightly different names and slightly different offices attached to it. Doctor, insurance, specialist, second doctor, different specialist, fax, email, silence, no. The repetition itself becomes the joke, because anyone who has ever had to deal with an insurance claim being delayed or denied will recognize that feeling of being sent in a circle that never quite closes. The visuals that go along with this song push the joke even further. As the boys keep moving from office to office, filling out the same information again and again, the hallways and staircases they walk through start to blend together and repeat, until the entire sequence turns into something resembling one of those famous drawings where staircases loop upward and downward at the same time without ever actually leading anywhere higher or lower. The boys are shown walking up and down what looks like an endless twisting staircase, technically always moving, technically always doing something, but never actually arriving anywhere new. This visual choice captures something that words alone might not fully land. It shows motion without progress, effort that goes nowhere, a system that keeps you busy without ever actually getting you closer to what you came for. Somewhere in the middle of all this, Butters becomes so buried and so lost in the paperwork itself that the show pushes the joke into a strange, almost dreamlike direction, showing him drifting through some kind of separate space entirely, cut off from time and from his friends, surrounded by nothing but the never-ending forms. It is an exaggerated, cartoonish moment, but it is built on a very real feeling, the sense that paperwork like this can swallow a person whole if they let it. Eventually, one of the doctors involved in this chase gives the boys a piece of information that works almost like the thesis of the entire sequence. He tells them in a calm, almost matter-of-fact way that the doctors, the pharmaceutical companies, and the insurance companies all kind of work together, and that because of that, all the boys really have to do is navigate the American healthcare system, as if that were a small, simple task rather than the impossible maze they have just spent the entire song trapped inside. The way this line is delivered matters just as much as what it says. There is no anger in it, no warning. It is said the way someone might explain how to get to a store 2 towns over, casual, almost helpful sounding, even though what he is describing is a system that has just spent several minutes bouncing 3 children between doctors, offices, forms, and phone calls with absolutely nothing to show for it. It is worth pausing here to notice exactly who gets blamed inside this sequence and how the blame is spread out. The insurance clerk is not shown as a villain twirling a mustache. He is shown as tired, boxed in by paperwork himself, doing a job that has clearly worn him down. The doctors along the way are not shown as cruel either. They are mostly shown as busy, following rules that exist somewhere above them, passing the boys along because the rules tell them to, not because they personally want to make anyone suffer. Even the elusive medical advisor on the boat is not given some evil monologue explaining why he loves denying claims. He is simply unreachable, distant, detached from the actual people affected affected by his decisions. This matters because the episode is not really building toward one bad guy standing at the center of everything. It is building toward the idea that the system itself, the way all these separate pieces are connected together, produces this outcome almost automatically, whether or not any one person intends to cause harm. That idea, a system producing harm without needing an obvious villain, is part of what makes this section of the special land so differently than a typical piece of comedy about a greedy business owner or a cartoonishly evil executive. There is no executive shown cackling behind a desk here. There is an old man with a typewriter who has clearly said the words the medical director's job is to say no more times than he can count. There is a doctor casually explaining that everyone in the system works together, almost proud of how efficient that arrangement sounds, without noticing or caring how it sounds from the other side of the desk. The special is not asking the audience to hate one person. It is asking the audience to notice how normal all of this looks from the inside, how routine it has become for everyone involved, except for the family standing in the middle of it trying to get medicine that has already been prescribed. By the time the song ends and the boys have made it through this loop, nothing has actually been resolved in the way they hoped. The claim still has not been approved through the normal channels. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. The claim was denied. The medicine was still out of reach, but somewhere in South Park, a shortage of that exact drug was already changing who could get it and how. And that shortage is where the next part of this story begins. Section 3. Big Pharma and the GLP-1 Gold Rush. The medicine at the center of the end of obesity is never treated as a small detail. It sits right in the middle of almost everything that happens in the special, and the story around it follows something that was actually happening across the United States around the same time the episode was written. To understand why Cartman's storyline hits as hard as it does, it helps to slow down and look closely at what this medicine actually is, why it became so hard to get, and who ended up getting it anyway. The drug in question belongs to a newer class of medicine, originally built to help people manage diabetes. Doctors and researchers noticed something extra happening in patients who took it. Along with helping control blood sugar, many patients also lost a significant amount of weight. Word of this spread quickly, first through medical circles, then through the news, and eventually through social media, where it became one of the most talked about topics in health and beauty content within a very short period of time. By the time this special aired in the middle of 2024, the drug and others like it had already become a nationwide phenomenon, showing up in magazine articles, talk show segments, and countless online videos from people documenting their own weight loss journeys. South Park treats this exact reality as the backdrop for Cartman's story. He is offered the drug because a doctor believes it could genuinely help him. This is not framed as some silly cartoon fantasy cure. It is framed the same way real doctors were talking about these drugs at the time, as something that had shown real, measurable results for people struggling with their weight. The show is not making fun of the medicine itself, or pretending it does not work. The joke is aimed somewhere else entirely, at what happens after a doctor writes the prescription. Because the drug was originally approved and studied for diabetes, insurance companies built their coverage rules around that original purpose. If a patient has diabetes, coverage is far more likely. If a patient does not have diabetes, even if a doctor believes the drug would help them lose weight and improve their health, coverage becomes far less certain, and in many cases, it is denied outright. This is exactly the wall Cartman runs into. He is not diabetic. His mother cannot afford the medicine without help. The insurance company will not budge. This single detail, the gap between what a drug was originally approved for and the wider ways doctors were actually prescribing it, was one of the most heavily discussed problems in American healthcare coverage at the time this special was made, and the show places it front and center, rather than treating it as a minor technicality. At the same time this coverage problem was unfolding, a second and completely separate problem was happening alongside it, and this is the piece that gives this section of the special its real energy. Demand for these drugs grew so quickly, driven partly by people who genuinely needed them for diabetes or serious weight-related health problems, and partly by a much larger group of people who wanted the drug simply to lose a smaller, more cosmetic amount of weight. This surge in demand ran far ahead of how much of the drug manufacturers could actually produce. The result was a real, well-documented nationwide shortage. Pharmacies across the country struggled to keep the medicine in stock. Patients who had valid prescriptions, including people managing diabetes, sometimes could not fill them because supply had run out. This shortage became serious enough that it drew attention from federal health regulators, who eventually stepped in to try to limit certain unofficial or unapproved versions of the drug that had started appearing outside normal pharmacy chains channels as people scrambled to find any version of it they could get their hands on. South Park folds all of this into its story rather than picking just one piece of it. The special shows the shortage as something affecting the entire town, not just Cartman's family. Adults in South Park are shown getting swept up in the same craze sweeping the rest of the country, some of them chasing the drug for reasons that have very little to do with genuine medical need. This becomes the show's second storyline, running alongside Cartman's, and it centers on Randy Marsh. Randy notices a number of women in town suddenly looking noticeably thinner, wearing clothing they had not worn before, and generally seeming different than usual. He does not initially understand that this is connected to the drug at all. Instead, misreads the situation completely, assuming these women are using the drug recreationally, the way someone might misuse a party drug, rather than understanding it as a weight loss and diabetes medicine being used, in many cases, without a real medical reason behind it. This misunderstanding becomes a running joke throughout the special, and it works because it mirrors something that was genuinely happening in real conversations at the time this episode aired. A blurry, confused public understanding of what this drug actually was, who it was meant for, and why so many people suddenly seem to have access to it. Randy eventually starts taking the drug himself, believing it to be something closer to a fun, no-consequence indulgence rather than a serious medication. He experiences a loss of appetite and no hangover, and treats this almost like he has found a new party trick, rather than something that came from a doctor's office. This part of the story pushes the satire in a very specific direction. It is not just asking whether insurance companies are fair, it is also asking a harder, less comfortable question about who ends up with easy access to a medicine like this when demand outpaces supply, and what that access is actually being used for. Randy, a grown adult with money and freedom to move around as he pleases, ends up experimenting with a drug almost casually, while a fourth grader with a real medical need, whose family has already been told by an actual doctor that he needs it, cannot get it covered at all. This contrast becomes even sharper through the character of Sharon, Randy's wife. After noticing Randy's sudden loss of appetite and suspecting he might be taking the drug, Sharon becomes self-conscious about her own body and starts wanting access to it herself, even though nothing about her situation suggests she has any medical need for it either. The special pushes this storyline into a strange and exaggerated direction from there, but underneath the exaggeration sits a very real question the show is clearly asking. If a medicine like this becomes trendy enough, how much of the demand driving shortages nationwide is coming from people who actually need it for a diagnosed condition, and how much is coming from people simply curious about a trend they have seen everywhere online? Meanwhile, back with Cartman and his friends, the shortage and the coverage denial push the boys toward a very specific and very modern solution. Unable to get the real, doctor-approved version of the drug through any official channel, Cartman and his friends turn to the internet, specifically to short instructional videos, to learn how to make a homemade version of the medicine themselves. This part of the plot is played for laughs, involving improvised equipment and a level of confidence in their own chemistry skills that nobody in that situation should probably have. But underneath the comedy sits something that was a genuine, documented concern among doctors and regulators at the time. As real shortages push people toward desperation, some individuals did turn to unofficial, non-pharmacy sources trying to get a version of these drugs any way they could, sometimes through online sellers, sometimes through compounded versions made outside the normal, tightly regulated manufacturing process that name brand medicine goes through. Regulators specifically raised concerns about the safety of these unofficial versions, since they had not gone through the same testing and quality checks as the approved drug. South Park takes this real concern and turns it into a plot point that drives much of what happens for the rest of the special. Kyle, disturbed by everything he has already seen from the insurance company, and now watching Cartman attempt something this risky, decides that if the boys are going to make a homemade version anyway, it should at least be done in a way that could help other people in the same position. People who also cannot afford or cannot access the official version through insurance. This decision by Kyle matters because it reframes what could have been a simple joke about kids doing something reckless into something closer to a small act of protest against a system that has already failed them once already through the insurance office. Once the homemade version actually starts working, at least well enough to noticeably curb Cartman's appetite, a new group enters the story, and this is where the special widens its target beyond just pharmaceutical companies and insurance providers. A collection of cereal mascots, clearly meant to represent large sugar and cereal manufacturers, become furious about what is happening. Their anger is not really about safety or regulation, it is about money. If people can lose weight without needing sugary food and drinks the way they used to, and if that shift threatens the sugar industry's business, these mascots are shown treating that shift as a direct threat that needs to be fought back against. Their solution is to develop and push a competing product of their own, described in the special as a new drug built around the idea of body positivity, one that works by suppressing the desire to lose weight in the first place, rather than helping anyone actually manage a real health condition. This storyline is clearly exaggerated for comedy. Cereal mascots do not really design pharmaceutical products in real life, but the underlying point being made is not exaggerated at all. Industries that profit heavily from foods high in sugar have a genuine financial interest in weight loss trends not becoming too successful or too widespread, since a thinner, healthier population buying less sugary food would directly affect their profits. By turning that real financial interest into cartoon mascots literally fighting back against weight loss medicine, the special makes an argument that would sound heavy-handed if stated directly, but lands as comedy because of how it is dressed up. One of the sharpest and most specific jokes in this entire storyline involves the singer Lizzo. Throughout the special, Lizzo and her music are presented as a supposed low-cost, drug-free alternative to the expensive medicine everyone is chasing, tied specifically to the body positivity movement the sugar mascots are trying to promote. This joke drew real attention once the special aired, including a public response from Lizzo herself, who addressed being referenced in the episode directly. The joke works because it ties a real, well-known cultural figure connected to body positivity messaging into the special's larger argument about who benefits, financially and otherwise, when people are told to feel good about their bodies exactly as they are, rather than pursuing medical treatments a doctor has recommended. The special is careful here. It is not mocking body positivity as an idea on its own. It is specifically mocking the way that message can be picked up and used by companies with a financial reason to discourage people from seeking treatment that might cut into their profits. Tony the Tiger, a well-known cereal mascot character, appears in the special as well, shown giving a kind of public statement encouraging people to stick with sugary cereal and to give up on weight loss drugs altogether, using his familiar catchphrase in a moment clearly meant to expose how strange it is to hear a cartoon mascot with an obvious financial stake in the outcome offering health advice to real families. This joke lands specifically because Tony the Tiger is such a familiar, friendly, non-threatening character in real American culture, making it land differently when that same friendly voice is shown defending an industry's profits rather than anyone's actual health. The special also introduces one more piece of medical satire connected to this storyline, involving Sharon's own condition later in the episode. After her involvement with the sugar mascot's competing product leads to a strange and exaggerated physical reaction, a doctor in the show diagnoses her with a fictional condition, described using a made-up term that sounds almost like a real medical diagnosis but is not one. This new diagnosis conveniently qualifies her for the very medicine everyone has been fighting to access throughout the entire special. This moment works as a kind of dark punchline about how flexible medical diagnoses can become once money and demand are involved, especially when compared to how rigid and unmoving the same system was earlier in the special when Cartman, a child with a doctor already recommending treatment, could not qualify at all. Taken together, all these different threads, the original coverage denial, the real nationwide shortage, the homemade drug plot, the sugar industry's competing product, and the strange new diagnosis that conveniently unlocks coverage build toward one consistent argument running underneath all the jokes. Access to medicine in this story has very little to do with who actually needs it the most. It has far more to do with who fits neatly into an approved category, who has the money and freedom to experiment casually, and who happens to be standing in the right place when a new diagnosis or a new product suddenly becomes convenient for someone else's bottom line. Cartman, the character whose situation kicked off the entire plot, spends most of the special exactly where he started, needing help that keeps slipping just out of reach, while the drug meant to help him becomes a nationwide craze touching almost everyone around him except him. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. This section is focused mainly on the drug itself, why it became so hard to get, and who ended up chasing it for reasons that had little to do with real medical need. But there is a separate, more specific piece of this puzzle that deserves its own close look: the exact process an insurance company uses to decide whether to approve a treatment in the first place. A process with a real name, real documented complaints from doctors across the country, and a very direct connection to the maze the boys were stuck inside in the insurance office. Section 4. Prior authorization. Fact-checked. The old man at the typewriter never used the words prior authorization. Nobody in the entire insurance sequence says that phrase out loud, not once. But almost everything happening in that office, the endless calls, the constant need for a second opinion, the forms that have to be signed by exactly the right person before anything moves forward, all of it lines up with a real process that has a real name in the American healthcare system. This section is going to slow all the way down and explain exactly what that process is, how it actually works behind the scenes, and why doctors across the country have been complaining about it for years, long before this drug shortage or this insurance office ever showed up in a cartoon. Prior authorization is a rule that many insurance companies use before they will agree to pay for certain treatments, tests, or medicines. The basic idea, at least as insurance companies explain it publicly, sounds reasonable enough on the surface. Before paying for something expensive, the insurance company wants a doctor to check in first and explain why this specific treatment is needed for this specific patient. In theory, this is supposed to stop unnecessary treatments from happening and keep costs from spiraling out of control for everyone. That is the official reason given for why this rule exists. In practice, according to doctors who deal with this system every single day, prior authorization often works very differently than that official explanation suggests. One physician who wrote directly about the South Park insurance sequence described working with a major insurance company and said plainly that the company will not even give doctors a full list of which procedures actually require this kind of approval ahead of time. Without that list, doctors are left guessing. Since getting it wrong means treatment gets delayed or denied later, many doctors and their staff end up requesting approval for almost everything just to be safe, even for treatments that might not have actually needed it in the first place. This detail matters a lot because it explains something that might otherwise seem strange. If insurance companies want prior authorization to prevent unnecessary treatment, why would they make it so hard for doctors to even know which treatments require it? The physician's explanation points toward a colder, more practical answer. When doctors do not know the rules clearly, they end up requesting approval constantly, which slows almost everything down, and slower care benefits the insurance company in a very specific way. According to the same doctor, when his office does go through the process and asks for prior authorization on nearly everything, the company almost always eventually says yes anyway. If the answer is usually yes in the end, the entire process starts to look less like a careful safety check and more like a delay built into the system on purpose, one that either wears patients down until they give up entirely, or pushes them toward paying for treatment out of their own pocket outside the insurance system altogether. Either outcome, the doctor points out, ends up saving the insurance company money, whether or not the patient ever actually gets the care they originally asked for. This is exactly the pattern the show captures inside its insurance office, even without ever naming it directly. The boys are sent from doctor to specialist to a different specialist to insurance and back again, each stop requiring new paperwork, new signatures, new confirmations. Nobody along the way tells them clearly what they actually need or how many more steps remain. They simply keep moving forward, filling out the same information again and again because that is what they are told to do at each new stop. This matches almost exactly what real doctors have described experiencing themselves when trying to get treatment approved for their own patients. The fax machine appearing in the insurance office deserves its own moment of attention here because it is easy to watch that detail and assume it is only there as an old-fashioned, slightly silly visual joke. A doctor commenting on this same episode pointed out that fax machines are, in fact, still genuinely used inside real prior authorization systems across the country even now. Despite nearly every other part of daily life having moved on to computers, phones, and instant messages, huge parts of the American healthcare system, especially the parts connected to insurance approval, still rely on paper forms being physically faxed back and forth between offices. This is not an exaggeration added purely for comedy. It is closer to an accurate snapshot of how outdated much of this communication process actually remains. Even inside a system responsible for handling some of the most important, time-sensitive decisions a person will ever face about their own health. It helps here to walk through, step by step, what a real prior authorization request usually looks like, so the size of this problem becomes easier to picture clearly. First, a doctor examines a patient and decides a certain treatment, test, or medicine is needed. This is the doctor doing their actual job, using their training and judgment to decide what a patient needs. Second, before that treatment can move forward, someone in the doctor's office has to check whether the patient's insurance company requires prior authorization for it. As already explained, this list is not always clear or easy to access, so many offices end up submitting a request no matter what, just to avoid a surprise denial later. Third, the doctor's office has to fill out specific forms explaining the medical reason for the treatment, often including detailed notes from the patient's file, and submit all of this to the insurance company. This step alone takes real time. It is not simply clicking a single button. It usually means someone on staff, sometimes a nurse, sometimes an office administrator, sometimes the doctor personally, has to sit down and put together this paperwork by hand. Fourth, the insurance company reviews the request. This step can take anywhere from a short amount of time to several days or even longer, depending entirely on the company and the specific treatment involved. During this entire waiting period, the patient does not receive the treatment their doctor has already said they need. Fifth, the insurance company responds with either an approval, a denial, or a request for more information, which restarts parts of this entire process all over again. If more information is requested, the doctor's office has to gather it and resubmit, adding even more delay before any final decision comes back. Sixth, if the request is denied, the patient or the doctor has the option to appeal that decision, which opens up an entirely separate, often even longer process, frequently requiring even more paperwork, sometimes additional documentation from other specialists, and sometimes a formal review that can stretch on for weeks. Laid out step by step like this, the process starts to look a lot less like a quick safety check and a lot more like its own small full-time job, layered directly on top of a doctor's actual medical work. This matches something real doctors have said publicly about the burden this creates. Physicians have described prior authorization as a major contributor to something referred to as physician burnout, a term used to describe doctors becoming exhausted, frustrated, and worn down not from treating patients, but from the sheer amount of paperwork and back and forth communication with insurance companies required just to get basic treatment approved for the people already sitting in front of them. This burden is not limited to a handful of unlucky doctors or a few unusually complicated cases. According to information shared by physicians on this exact topic, every single physician practice, every clinic, and every hospital across the country has to keep staff on hand specifically to handle this kind of work. In many cases, this means hundreds of people employed at a single hospital system whose entire job, day after day, is simply calling and faxing insurance companies over and over, trying to eventually get to a yes for patients who are often waiting anxiously on the other end for treatment they may genuinely need right away. Stop and sit with that fact for a moment. Hundreds of employees at a single hospital whose entire job exists only because insurance companies require this level of back and forth before agreeing to pay for care. None of these employees are treating patients directly. None of them are nurses giving medicine or doctors performing exams. Their entire job is paperwork, phone calls, and faxes, existing purely to satisfy a process that, according to doctors who deal with it firsthand, frequently results in approval anyway after all that time and effort. This is where the size of the cost becomes clear, and it is worth being specific about what kind of cost this actually is. It is not just measured in stress or frustration, although both of those are very real. It is also measured in money, real money, spent purely on administrative work rather than on any actual medical care. Every person hired specifically to manage prior authorization paperwork needs a salary. Every fax machine, every hour spent on hold with an insurance company, every form filled out and refiled after a request for more information, all of it costs money. According to physicians who have spoken about this publicly, this administrative cost adds up to billions of dollars across the country every year. Money that ultimately gets folded back into the premiums patients pay for their insurance and into the taxes that help fund public healthcare programs. In other words, the very process meant to help control healthcare costs ends up adding a significant cost of its own, one that gets passed along in one way or another to the same patients the process is supposedly designed to protect. It is also worth pointing out something else doctors have specifically noted about this process, something South Park's insurance office captures almost perfectly without ever spelling it out directly. Original Medicare, the government health insurance program for older Americans and certain people with disabilities that is not run through a private company, generally does not use this same kind of prior authorization requirement the way private insurance plans and privatized versions of Medicare do. This detail matters because it shows prior authorization is not some unavoidable universal rule that every health system on earth has to follow. It is a choice, one made specifically within certain types of private insurance arrangements rather than something that has to exist purely for medical or safety reasons. Bringing this back to the show itself, the special never explains any of this directly to its audience. It does not include a character stopping to define prior authorization or walk through these steps out loud. Instead, it simply shows the experience of it over and over through the boys being bounced endlessly between offices, phone calls, forms, and confirmations without ever being told clearly what is actually required of them or how closely they are to finally getting an answer. According to doctors who work inside this exact system every day, that confusion is not an exaggeration added for comedy. It is close to an accurate description of what many patients and doctors genuinely experience, minus the cartoon staircase. Efforts to change this system have not gone completely unnoticed by lawmakers and regulators either. Some states, along with the federal agency responsible for overseeing government health insurance programs, have taken steps in recent years specifically aimed at limiting how prior authorization can be used, trying to speed up decisions or reduce how often it gets required in the first place. The fact that this kind of reform has become necessary, that lawmakers have felt the need to step in and specifically limit a private company process, says something on its own about how significant this problem has become across the country, well beyond any single insurance company or any single patient's story. None of this means every single prior authorization request is unnecessary or unfair. Insurance companies argue publicly that some level of medical review does genuinely help prevent unneeded procedures and helps keep healthcare spending under control for everyone paying into the system. That argument is not without any basis, but according to doctors who deal with the day-to-day reality of submitting these requests, actually waiting on them, and often ultimately getting approval anyway after significant delay, the system as it currently works looks less like a careful, thoughtful safety check and much closer to a slow-moving obstacle, one that costs everyone involved real time, real money, and in some cases, real harm, before a patient ever actually receives the treatment their own doctor already decided they needed. This is the exact mechanism sitting quietly underneath every verse of the song from the last section, every trip back to a different doctor, every request for a second opinion from someone in network, every fax sent to a medical advisor who never seems reachable. None of it happens because anyone in the story is being deliberately cruel. It happens because this is simply how the process is built to run, a process doctors themselves have publicly described as slow, frustrating, and financially costly for everyone but the insurance company itself. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. The doctor's own words and the small details buried inside this one insurance office scene only tell part of the story. A much larger national picture exists behind all of this, built from actual survey data collected from thousands of real insured Americans describing their own experiences trying to get care. That data is where this video goes next, laying out exactly how common these obstacles really are across the entire country. Section 5. The KFF data behind the joke. Everything covered so far in this video has come from watching the special closely and from doctors who spoke publicly about how closely it matches their own daily work. This section is going to step outside the show entirely for a moment and look at something different. A large study that surveyed thousands of real, insured Americans about their own personal experiences trying to get healthcare paid for. This study was not made by South Park, was not inspired by South Park, and existed before this specific special ever aired. It simply happens to describe, in plain numbers, almost exactly what the boys went through inside that insurance office. Before getting into the numbers themselves, it helps to understand what kind of study this actually is and why it carries weight. A group known for researching health policy in the United States conducts large surveys on a regular basis, asking real people detailed questions about their healthcare, their insurance, their costs, and their experiences trying to get treatment. These are not small, casual polls asking a handful of people a quick opinion. They are large, carefully built surveys designed to represent a wide range of Americans across different states, different incomes, different ages, and different health conditions. In June of 2023, one of these surveys focused specifically on people who already had health insurance, asking them directly what kind of problems they ran into when they actually tried to use it. This detail matters a lot. This was not a survey asking people without insurance about the struggle of going without coverage, a problem that gets talked about often and is already well understood by most people. This was a survey asking people who already had insurance, people who were already paying for a plan every single month, whether having that insurance actually made getting healthcare easier. The answers reveal a lot about why a scene like the one inside South Park's insurance office feels so familiar to so many people watching it. The survey included responses from 3,605 adults across the country, every single one of them already covered by some form of health insurance. When researchers asked these people directly about problems they had faced while trying to get care, the results showed that a large number of them ran into serious obstacles, even with insurance already in hand. 3 specific problems came up again and again throughout the survey results. The first was claims being denied, meaning the insurance company refused to pay for something a doctor had already recommended or already provided. The second was trouble with something called a provider provider network, meaning patients ran into problems finding a doctor or specialist that their specific insurance plan would actually agree to cover, sometimes forcing them to travel further, wait longer, or pay significantly more out of pocket just to see someone their plan considered acceptable. The third was trouble connected to pre-authorization, the exact process explained in the last section, where a doctor has to get approval from the insurance company before a treatment can move forward. Reading these three problems side by side, it becomes clear that South Park did not invent a single one of them for comedy. Every obstacle placed in front of the boys during their trip through the insurance office lines up directly with one of these three categories. The claim itself gets denied at the very start. They are told repeatedly that they need a doctor who is in network, matching the second problem exactly, and the entire song is essentially one long demonstration of the third problem, waiting on approval after approval, form after form, before anything can actually move forward. The special did not need to invent anything unusual to make its point. It simply took three of the most common, most heavily reported problems facing insured Americans and turned them into a single, connected storyline. One number from this survey deserves special attention because of how directly it connects to the specific situation Cartman finds himself in during the special. The survey found that 2 out of every 3 adults who described their own health as fair or poor, meaning people who were already dealing with real ongoing health problems, reported running into these kinds of obstacles while trying to get care. Read that again slowly. This was not 2 out of 3 people overall. This was 2 out of every 3 people who were already sick, already struggling with their health, already the group of people who arguably need their insurance to work smoothly the most. For this specific group, the people insurance exists to help the most, roughly 2/3 still reported facing serious barriers just trying to access the care they needed. This connects directly back to Cartman's situation in a very specific way. He is not a healthy kid trying to get medicine for a minor issue. A doctor has already told him and his mother directly that his weight puts his health at real risk. He falls exactly into the category of person this survey describes, someone already dealing with a real health concern, exactly the kind of person the data shows is more likely, not less likely, to run into serious trouble getting insurance to actually help. It helps here to walk through what these numbers mean in a more grounded way, moving away from percentages for a moment and thinking about actual people. Imagine a room full of 100 people, all of them already sick or already struggling with their health in some way, and all of them already paying for health insurance every month. According to this survey, roughly 67 of those 100 people will at some point run into a real obstacle trying to use that insurance to actually get help. Not because they lack coverage entirely, not because they cannot afford a monthly payment, but because the system built around that coverage, the claims process, the network rules, the approval requirements, creates barriers even after someone has already done everything right by paying for a plan in the first place. This is where a separate finding mentioned in an earlier part of this research becomes especially useful for understanding why this happens so often. A major medical journal noted that many people are, in its own words, hopelessly confused by how their insurance actually works. This is not a small side comment. The same source found that about half of consumers say they do not fully understand some part of their own coverage, and about 1/3 specifically say they do not understand what costs their plan actually covers, or what costs they personally will still owe even after insurance pays its share. Sit with that second number for a moment. 1 out of every 3 people with health insurance does not clearly understand what their own plan will and will not pay for. This is not a small technical detail buried somewhere in fine print that only a few unlucky people happen to miss. This is roughly 1/3 of every single person carrying an insurance card in their wallet, walking into a doctor's office without a clear, confident understanding of what happens financially once treatment actually begins. This confusion connects directly to something a professor from Harvard Medical School specifically pointed out when discussing why healthcare and insurance in America are so difficult for ordinary people to understand and navigate. According to this professor, one major factor is how much prices vary from one place to another and from one insurance company to another. The exact same treatment, the exact same medicine, the exact same visit to a specialist can cost wildly different amounts depending on which doctor a patient sees, which hospital they go to, and which insurance plan they happen to be carrying. This kind of variation makes it extremely difficult for an ordinary person to compare their options ahead of time, or to make a confident, informed decision about their own care, the same way they might compare prices before buying almost anything else in their daily life. Put these two pieces of information together, the widespread confusion about coverage and the wide variation in prices depending on provider and plan, and a clearer picture starts to form of why an ordinary family can end up lost inside a maze, exactly like the one shown in South Park's insurance insurance office. It is not simply that insurance companies choose to be difficult on purpose in every single case. It is that the entire system is built with enough complexity, enough variation, and enough unclear rules that even people who are paying close attention and trying their best can still end up confused, denied, or stuck waiting for an answer that never seems to arrive clearly. This survey also asked people about a related and very practical concern, whether they were putting off care because of cost or confusion, even with insurance already in place. While the specific numbers around delayed care were not broken down in as much detail here, the general pattern uncovered by this kind of research lines up with something doctors have said publicly for years. When people are unsure whether something will be covered, unsure how much they will personally owe, or unsure whether they will be denied after already going through the trouble of getting a referral or an appointment, some of them simply choose to wait, or to avoid seeking care altogether, even when a real health problem exists. This is not laziness or carelessness on the patient's part. It is a reasonable, cautious response to a system that has made getting a clear, simple answer surprisingly difficult. It is worth pausing to compare this real survey data against the specific scene from the special one more time, now with these numbers freshly in mind. The special shows an old insurance clerk explaining that the medical director's entire job is just to say no. At first glance, this line sounds like pure comedic exaggeration, a joke pushed to its most extreme cartoonish point purely for effect. But when placed next to a national survey showing that roughly 2 out of every 3 already sick, already insured adults report running into real obstacles getting care, the line stops sounding quite so exaggerated. It starts sounding more like a blunt, simplified version of something a huge number of real people have actually experienced, just without the exact same joke wrapped around it. This is also a useful moment to notice something about how the special chooses to tell this story. It never shows a narrator on screen explaining these statistics directly to the audience the way a documentary might. It never pauses the plot to display numbers on a chart. Instead, it tells this same underlying truth through character, through Cartman's heartbreak, through Kyle's stubborn refusal to give up, through Butters getting lost inside an endless pile of paperwork, and through one tired old clerk explaining, almost gently, that his own job exists specifically to deny people. The research and the comedy are, in the end, describing the exact same reality. They are simply using 2 completely different tools to get there, one built from numbers and surveys, the other built from characters and jokes. There is one more important detail buried inside this same body of research worth mentioning here, connected specifically to the size and seriousness of this survey. 3,605 people is a large number for a single survey, large enough that researchers can feel confident the results reflect patterns happening across the wider country, not just a small, unusual group of unlucky individuals. When a study reaches this size and still finds such a high number of people reporting the exact same 3 problems, denied claims, network trouble, and pre-authorization delays, it becomes much harder to treat these problems as rare exceptions. They start to look instead like a normal, expected part of many people's experience with health insurance in America, something closer to the rule than the exception. This distinction matters when thinking about how South Park chose to build its story. The special did not build its plot around some rare, unusual case, a bizarre 1 in a million insurance mistake included purely for shock value. It built its plot around exactly the 3 problems this large national survey found happening most often, to the largest number of people, especially among those already dealing with real health issues. In other words, the writers were not reaching for the most extreme version of insurance trouble they could imagine. They were reaching, whether intentionally or simply through good instinct about what audiences would recognize, for the most common version. This helps explain something else worth sitting with for a moment. Why so many doctors, patients, and everyday viewers responded so strongly to this specific special once it aired. Some going so far as to call it closer to a documentary than a comedy. A joke usually needs some kind of exaggeration to work, some gap between the joke and real life that makes it feel absurd enough to laugh at. But when a joke lines up almost exactly with data collected from thousands of real people describing their own real experiences, that gap starts to shrink. The laughter that comes from watching it starts to carry a different kind of weight, closer to recognition than to simple absurdity. None of this means every single insurance company treats every single patient exactly the way the special portrays. Plenty of claims are approved without any trouble. Plenty of people go through their entire lives with insurance and never personally experience the kind of maze shown inside that office. But the numbers from this survey make clear that this experience is common enough and serious enough, especially for people people already dealing with real health problems that building an entire storyline around it required very little exaggeration at all. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. With this data now laid out clearly, it becomes easier to understand why the special did not stop at insurance companies alone. Insurance is only one piece of a much larger system, and South Park was careful to point its jokes at more than one target. Sitting right alongside the insurance company in this story is another industry with its own financial stake in whether people stay sick or get healthy. One built not around doctors or claims forms, but around sugar, cereal, and the kind of products found on almost every grocery store shelf in the country. Section 6. Big Sugar as co-defendant. There is a third player standing right alongside the drug company and the insurance company for most of this story, and it does not wear a doctor's coat or sit behind a claims desk. It shows up dressed as a tiger, a rooster, and a handful of other cartoon mascots most people recognize from the cereal aisle of any grocery store in America. To understand why this storyline works the way it does, it helps to start with a simple question. If a drug exists that can genuinely help people manage their weight and improve their health, who would actually be upset about that? The insurance company's resistance already makes a certain kind of sense once money and coverage rules get involved. A doctor recommends something, an insurance company decides it does not want to pay for it, and the family is left stuck in the middle. That part of the story lines up with something most people have already heard about or experienced themselves. But the special introduces a second group with a completely different reason to be unhappy about Cartman losing weight, one that has nothing to do with paperwork, coverage categories, or medical diagnosis codes, and everything to do with what happens to their sales if people across the country simply stop eating as much sugar as they used to. This is where the cereal mascots enter the story. Once the homemade version of the weight loss medicine starts working, curbing Cartman's appetite and drawing interest from other people around town who cannot get the real thing through insurance, a group of mascots clearly modeled on real cereal brand characters becomes furious. Their anger is shown as coming from a very specific and very simple place. Not concern for anyone's well-being, but concern for their own bottom line. If people can control their weight without needing sugary breakfast cereal, sugary drinks, and sugary snacks the way they used to, the companies that make and sell those products stand to lose a significant amount of business. The special treats this financial threat, not any imagined worry about health or safety, as the true reason these mascots snap into action. Their response, once they realize a homemade weight loss remedy is spreading through the town, is to create and push a competing product of their own. This product is described in the special as a new kind of drug, one built around the idea of body positivity that works by suppressing the desire to lose weight in the first place, rather than treating any real medical condition at all. On the surface, this sounds like pure cartoon invention. No real cereal company in the actual world has ever released a pill designed to make people stop wanting to lose weight. That specific product does not exist outside the special, but underneath that exaggerated joke sits a genuine, well-documented pattern from the real history of the American food industry, one worth slowing down and walking through carefully, because it is the reason this joke lands as hard as it does, rather than feeling like a random disconnected gag. For decades, companies that sell sugary food and drinks have had a direct financial interest in how the public understands sugar's connection to serious health problems like obesity, diabetes, and heart disease. This is not a matter of opinion, and it is not something South Park's writers made up to strengthen their joke. It comes from real historical research that has been reported on by respected medical publications. One especially well-documented example goes back to the 1960s, a period when heart disease was becoming one of the biggest public health concerns in the United States, and scientists were racing to figure out exactly what was causing it. During this exact period, an industry group representing sugar producers quietly paid a group of scientists to conduct research specifically aimed at shifting public blame for heart disease away from sugar and toward fat instead. This research was written up and published in a respected medical journal at the time, carrying the weight and credibility that comes with appearing in serious scientific literature. For years afterward, this same research helped shape public health advice given to ordinary Americans, and it even helped shape official government dietary guidelines, the same kinds of guidelines that eventually influenced things like school lunch programs and the widely recognized food pyramid many people were taught to follow growing up. What makes this story even more significant is what happened afterward, hidden for decades before finally coming to light. The sugar industry's financial involvement in funding and shaping this research was not disclosed to the public at the time it was published. Doctors reading the study, government officials using it to write dietary guidelines, and ordinary families trying to eat healthier based on official advice had no way of knowing that the very research shaping their their understanding of sugar had been quietly funded by the sugar industry itself. It was not until decades later, when historians and researchers went back through old internal documents connected to the sugar industry, that the full extent of this funding and coordination became clear. Once uncovered, this discovery was significant enough to be reported on by a major medical journal, drawing renewed public attention to a decision made half a century earlier that had quietly shaped how millions of Americans thought about their own diets. This piece of real history matters enormously for understanding why the joke about cereal mascots fighting weight loss medicine works as well as it does inside the special. The show did not invent the underlying idea of a powerful food industry using its financial resources to shape how the public understands diet, health, and disease. That pattern already exists clearly in the real historical record, tied to an actual named industry group, actual funded scientists, and an actual published study that shaped real government guidelines for years. The special simply takes that same basic pattern, an industry protecting its own profits by influencing public health messaging, and pushes it into a louder, more exaggerated, more cartoonish form, replacing paid scientists and funded studies with talking cereal mascots and a fictional body positivity pill. The underlying mechanism being satirized is completely real. Only the costume it is wearing on screen is fictional. It helps here to think about why this specific joke, dressing corporate self-interest up as friendly cereal characters, works so well as comedy in the first place. Cereal mascots occupy a very particular place in American culture. They are designed from the very beginning to feel warm, harmless, and trustworthy, aimed specifically at children and at parents trying to make quick decisions about what to buy at the grocery store. Nobody grows up feeling threatened by a cartoon tiger on a cereal box. That feeling of harmlessness is not an accident. It is a carefully built piece of marketing, meant to create a sense of comfort and familiarity around a product. By taking that exact same friendly, non-threatening image and turning it into the driving force behind blocking a child's access to weight loss medicine, the special exposes something uncomfortable hiding underneath that friendliness. The fact that these familiar, cheerful characters exist specifically to sell products, and that selling those products sometimes runs directly against the actual health interests of the very children these characters were designed to appeal to. This connects directly to the storyline involving the singer Lizzo, who appears throughout the special as a supposed low-cost, drug-free alternative to the expensive weight loss drug everyone in town is chasing, tied specifically to the body positivity movement the sugar mascots are pushing as their preferred solution instead of medicine. It is worth being precise about exactly what this joke is aiming at, because it would be easy to misread it as simply making fun of body positivity as an idea, or making fun of Lizzo personally. That is not quite what is happening. The joke is aimed at something more specific, the way a genuinely positive, healthy message about accepting your own body can be picked up, repackaged, and pushed by companies that have a direct financial reason to discourage people from seeking medical treatment that might cut into their profits. Once a company can point to a warm, feel-good message like this and use it to quietly steer customers away from medicine that might actually help them, the message itself stops functioning as comfort or encouragement and starts functioning as a kind of marketing tool, aimed less at making anyone feel better and more at keeping them exactly where they are, still buying the same sugary products as before. Tony the Tiger appears in this same storyline in one of the special's more pointed moments, shown giving what looks like a public statement encouraging people to stick with sugary cereal instead of pursuing weight loss drugs, using his familiar catchphrase in a scene clearly built to expose how strange it sounds coming from a character with such an obvious financial stake in the outcome. This joke lands specifically because Tony the Tiger is such a familiar, gentle, non-threatening figure in real American culture, recognized instantly by children and adults alike from decades of television commercials and cereal boxes. Hearing that same warm, cheerful voice suddenly defending an industry's profits instead of anyone's actual health creates exactly the kind of gap between expectation and reality that good satire is built on. The audience already knows this character. The special simply asks them to notice, for the first time, exactly whose interests that character has always been serving. Taken together, the insurance company denying Cartman's claim and the sugar industry fighting to keep him from losing weight at all are not two separate, unrelated stories placed side by side purely by coincidence. They are two entirely different industries, pulling in completely opposite directions, both acting out of their own financial interest rather than any real concern for Cartman himself, with his actual health caught somewhere in the middle of both forces at once. One side profits by denying him treatment, the other side profits by making sure he never stops needing that treatment in the first place. Neither side is shown caring much about him as a person. Both sides are shown caring a great deal about their own bottom line. This dynamic also helps explain why the special avoids pointing at a single villain the way a simpler story might. It would be easy to write a version of this plot where one greedy insurance executive is clearly the bad guy, solely responsible for every problem in the story. Instead, the special widens its lens, showing an insurance system built around denial, a pharmaceutical shortage driven partly by real medical need and partly by trend-driven demand, and a food industry with its own long-documented history of shaping public understanding of health for profit, all operating at the exact same time around the exact same child. No single company or single decision is shown as the sole cause of Cartman's situation. Instead, several separate systems, each pursuing its own financial interest, happen to overlap around him, and the combined weight of all of them together is what leaves him stuck. There is a reason this particular argument, several industries all pulling in different directions around the same person, deserves this much attention. It mirrors something many public health researchers have pointed out about real obesity and diet-related health problems in America more broadly. The idea that no single company or single decision is usually responsible for these problems on its own. Instead, many different industries, food companies, drink companies, insurance companies, and drug companies among them, each shape small pieces of a much larger picture, often without any single company needing to do anything that looks dramatically evil on its own. The special captures this same idea by refusing to give the audience one simple villain to blame, and instead showing several ordinary-seeming businesses, each protecting its own interests, quietly working against each other around a single struggling family. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. By the end of this part of the story, Cartman is left standing in almost the exact same place he started, still needing help, still caught between industries that each have their own reasons for wanting him to either stay exactly as he is, or seek treatment on someone else's terms rather than his own. The insurance company has already said no. The sugar companies have already fought back. And still waiting in the background of this entire story is a fourth industry, one that supplied the actual pills at the center of a much darker chapter in recent American medical history. A chapter the show tackled years earlier in an entirely different episode, one that deserves its own close look next. Section 7. Hummels and Heroin, the Opioid Crisis. Up until now, this video has stayed almost entirely inside one single special, the end of obesity, and the many different angles it takes on insurance, drugs, and food. But South Park's history with American healthcare goes back further than that one special, and one particular episode from 2017 deserves its own close look, because it takes on a subject far more serious than a denied insurance claim. That episode is called Hummels and Heroin, and underneath its strange, cartoonish plot sits one of the most direct arguments the show has ever made about who is actually responsible for a real national tragedy. Before getting into the episode itself, it helps to understand what was actually happening across the country around the time it aired. By 2017, the United States was in the middle of what health officials and news outlets were widely calling an opioid crisis. Opioids are a category of medicine, most commonly prescribed by doctors to treat serious pain, and they include drugs like OxyContin, an especially well-known brand name painkiller that had become tied up in the crisis in a very specific way. Starting in the 1990s, doctors across the country had begun prescribing opioid painkillers at a rate far higher than in previous decades, and by the 2010s, addiction to these drugs, along with related street drugs like heroin, had grown into one of the most serious public health emergencies the country had faced in generations. Hundreds of thousands of Americans died from opioid overdoses during this period, a number large enough that entire communities, entire families, and entire towns were left dealing with the loss. South Park chose to take this subject on directly, but true to the show's style, it did not do so through a straightforward, serious drama. Instead, it built an entire storyline around a children's birthday party, a beloved pizza restaurant mascot, and a small, determined boy trying to solve what looks, on the surface, like a strange and ridiculous mystery. Underneath all of that, though, sits a very clear and very deliberate argument about exactly who deserves blame for what was happening in real hospitals, real homes, and real communities at that exact moment in American history. The episode opens at a child's birthday party, the kind of event most kids in South Park have attended dozens of times without anything unusual happening. A costumed mascot resembling the character from a well-known chain of pizza restaurants and arcades, closely modeled on Chuck E. Cheese, a real business many American children have visited for birthday parties over the years, is performing for the kids as part of the entertainment. In the middle of this performance, the mascot suddenly collapses in front of the children, choking on his own vomit after overdosing on a painkiller. This moment happens right in the middle of what should be an ordinary, happy children's event, and the show does not soften how disturbing that setting is. A costumed character meant to represent fun and safety for young kids dies from a drug overdose directly in front of them. Among the children witnessing this collapse is a boy named Marcus Preston, and his reaction becomes the emotional center of the entire episode. Marcus is deeply shaken by watching this happen, and rather than simply moving past it the way a typical episode might expect a background character to do, the show turns him into its own kind of detective, styled clearly after the type of sharp, determined investigator seen in classic mystery stories, the kind of character who refuses to let a case go unsolved, no matter how young or how small they are. Marcus becomes consumed with figuring out exactly who is responsible for what happened to the mascot he watched collapse in front of him, and this investigation becomes the thread pulling the entire episode forward. At first, Marcus focuses his suspicion on one of the show's main characters, blaming him for what happened, and this early guess turns out to be only partly correct. As Marcus keeps digging, he is eventually told, in one of the episode's more pointed moments, that the real people responsible go much deeper than any one person he might suspect at school. He is essentially told to go after what the episode describes as the real people who profit from all of this, rather than any single individual close to home. This line matters because it marks the moment the episode stops being simply a mystery about one strange incident and starts pointing directly at a much larger system sitting behind it. Following this lead, Marcus eventually uncovers a drug smuggling operation, one built around an unusual and specifically chosen method of transport. Painkillers are being smuggled out and sold to people through crocheted pillows, tied to an elderly community connected to a nursing home. The exact mechanics of this smuggling ring are, as the earlier research on this episode points out, meant to be strange and absurd rather than realistic. Nobody is claiming that a real nursing home drug ring using crocheted pillows as its method of choice actually existed exactly this way in real life. This part of the plot is clearly built for comedy and shock value, not as a literal retelling of any specific real case. But it is important to separate the absurd delivery method from the underlying argument the episode is actually making, because that argument is not exaggerated at all. One piece of commentary written specifically about this episode makes a very direct and very serious point. While the show's picture of how these drugs got smuggled and sold is played for laughs, the real truth behind the actual opioid crisis happening in America at the time was, in this writer's own words, far uglier than anything shown on screen. According to this commentary, real pharmaceutical companies systematically went out of their way to pressure real health professionals into prescribing their pain-killing products, even for minor injuries and conditions that did not come anywhere close to justifying the serious risk of addiction that came with those drugs. This is the core argument sitting underneath the entire episode, and it deserves to be stated plainly, separate from any of the show's jokes. The opioid crisis in America was not simply a story about individual people making poor personal choices. It was, according to extensive real-world reporting, legal investigations, and eventually courtroom findings, a crisis with clear and specific corporate roots. Pharmaceutical companies that manufactured opioid painkillers spent enormous amounts of money marketing these drugs directly to doctors, funding conferences, paying for meals and travel, and providing materials that downplayed how addictive these medications actually were. Sales representatives were sent out across the country specifically tasked with encouraging doctors to prescribe these drugs more often and in higher doses, sometimes receiving bonuses tied directly to how many prescriptions they could help generate in their assigned territory. One company in particular became especially connected to this story in the years following the episode's release, a company that made one of the most widely known and widely prescribed opioid painkillers on the market. That company and the family who owned it eventually faced an enormous wave of lawsuits from state governments, cities, and individual families, all arguing that the company had knowingly downplayed the addictive risks of its product while aggressively pushing doctors to prescribe more of it. These lawsuits eventually led the company into bankruptcy proceedings and resulted in a series of legal settlements requiring the company and its owning family to pay out enormous sums of money, some of it directed toward communities and families affected by opioid addiction across the country. None of this happened before the South Park episode aired in 2017. Much of the most significant legal action and public reporting connected to this story unfolded in the years that followed. But the underlying behavior behavior these later lawsuits exposed, aggressive marketing, downplayed addiction risk, and financial pressure placed directly on doctors, was already understood well enough by 2017 for South Park's writers to build an entire episode's worth of blame around it. The commentary written specifically about this episode does something worth noting here. It states plainly that the opioid epidemic is the fault first of pharmaceutical companies and second of doctors who went along with the incentives those companies offered them. This ordering matters. It does not place equal blame on every party involved. It places the heaviest responsibility specifically on the companies that manufactured and marketed these drugs, with doctors carrying a real but secondary share of responsibility for allowing themselves to be influenced by that marketing pressure. This same ordering shows up clearly inside the episode itself. The mascots who overdose are portrayed as victims of a system built around them, not as people who simply made careless choices on their own. And the operation supplying the drugs is portrayed as something organized, deliberate, and profit-driven, run by people who understood exactly what they were doing and who was being harmed by it. It helps here to look at a few of the specific choices the episode makes in choosing its victims, because those choices are not random. The characters who overdose across the episode are all costumed mascots, dressed as familiar, beloved children's characters, including figures resembling Spider-Man and Peppa Pig, alongside the Chuck E. Cheese-style mascot from the opening scene. This choice creates a very specific and very uncomfortable effect. These are not shady, hardened adult characters the audience might expect to see caught up in a drug story. They are, visually, characters built entirely around comfort, safety, and childhood innocence. The exact kind of figures a parent would trust completely at their own child's birthday party. By placing the opioid crisis directly inside these familiar, trusted costumes, the episode forces a kind of discomfort that a more distant or unfamiliar victim never could have created in the same way. It becomes much harder to treat addiction as a distant, abstract problem happening to other people somewhere else, when the show wraps its victims in the exact costumes children already trust without question. This choice also connects to something written specifically about the episode's larger cultural impact. One piece of commentary argues that South Park managed, through this single episode, to identify the real culprits behind the opioid crisis with more clarity than most politicians in Washington seemed willing to offer at the time, across both major political parties. This is a striking claim to make about an animated comedy, but it points towards something worth taking seriously. Where many public conversations at the time tended to focus heavily on individual addicts, on personal responsibility, and on street-level drug dealers, this episode chose instead to point its investigation upward, toward the companies and financial incentives sitting behind the crisis in the first place. That decision, choosing to point toward corporate responsibility rather than individual blame, matched what later legal findings and investigative reporting would go on to confirm in the years following the episode's release. It is also worth returning briefly to Marcus Preston himself, and what his character choice adds to the episode's overall argument. Marcus is not written as an adult investigator, a journalist, or a government official. He is a child, deeply affected by witnessing something violent and disturbing at what should have been an ordinary birthday party, choosing to take matters into his own hands because the adults around him do not seem to be doing anything about it. This detail mirrors something that shows up again and again throughout real accounts of the opioid crisis. The way children in affected communities were often left to deal with the fallout of addiction happening around them, sometimes losing parents, sometimes watching family members struggle, often without the resources or support systems that should have been in place to protect them. Marcus taking on the role of a determined investigator, refusing to let the adults around him simply move past what happened, works as a kind of stand-in for every young person forced to grapple with a crisis that adults in positions of power were slow to fully address. By the end of the episode, the smuggling operation is uncovered, and some measure of resolution is reached. Though true to the show's usual style, it comes wrapped in absurd, over-the-top plotting, rather than a clean, straightforward conclusion. But the emotional and factual weight of the episode does not really live in how neatly its plot resolves. It lives in the argument sitting underneath the whole story, that a real, deadly national crisis, one that had already killed enormous numbers of real Americans by the time this episode aired, deserved a comedy show willing to point directly at the companies and financial incentives responsible for it, rather than settling for easier, softer targets. This episode stands apart from almost everything else covered so far in this video in one important way. The other episodes explored earlier center mainly on frustration, confusion, and unfairness inside the healthcare system. People trying to get help and being blocked by paperwork, denied claims, or competing financial interests. Hummel's and Heroin heroine moves into darker territory entirely, dealing directly with addiction and death. And it does so by placing corporate responsibility front and center, rather than treating addiction as simply a personal failing. This choice reflects something that has become increasingly accepted and increasingly documented in the years since this episode first aired, that the opioid crisis was, at its core, shaped heavily by decisions made inside pharmaceutical company boardrooms, not simply by individual weakness or poor choices made by the people who became addicted. There is one more detail from this episode worth sitting with before moving forward, because it ties directly into the next part of this video. The episode chooses, very specifically, to route its drug smuggling operation through an elderly community connected to a nursing home. This choice is played for shock and absurdity in the show, crocheted pillows being an especially strange smuggling method, but it also quietly reflects a real pattern that has shown up in actual reporting on the opioid crisis. Cases where medications prescribed to elderly patients, sometimes in large quantities, ended up being diverted, sold, or misused outside of their intended purpose. Whether the show's writers were directly referencing this specific pattern or simply reaching for an unexpected, unsettling setting for their joke, the choice lines up with a real, documented weak point inside the larger system responsible for controlling how these powerful drugs move through American communities. Hummels and Heroin shows a version of South Park willing to step almost entirely away from comedy about paperwork and denied claims and instead confront a national tragedy directly, assigning blame in a way that closely mirrors what courts, journalists, and public health officials would go on to confirm in the years that followed. It stands as one of the clearest examples in the show's entire history of comedy being used not just to entertain, but to make a specific, researched argument about who was actually responsible for real, documented harm happening to real people across the country. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. The opioid crisis was never really about doctors handing out medicine to help people manage real pain. It became something else entirely, an industry deciding certain diagnoses were simply worth more money than others. That same idea, an institution reshaping what counts as a real medical condition, once profit and public pressure get involved, is exactly where this video turns next. Section 8. Medicalizing behavior, sexual healing. Every episode covered so far in this video deals with a real, physical condition. Weight, pain, addiction, something a doctor could point to on a chart or a scan. But there is a different kind of episode in South Park's history. One that asks a stranger, and in some ways, more uncomfortable question. What happens when an entire system decides that ordinary human behavior should be treated as a medical disease? Not because of clear scientific proof, but because it becomes convenient, profitable, or politically useful to label it that way. That episode is called Sexual Healing, and it aired back in March of 2010, years before any of the other episodes discussed in this video. To understand why South Park chose this topic at this exact moment, it helps to look at what was actually happening in the news at the time. In late November of 2009, professional golfer Tiger Woods, at the time one of the most famous and most successful athletes in the entire world, was involved in a car accident outside his home in Florida. In the days and weeks that followed, this single accident opened the door to a much larger and much more public scandal, as multiple women came forward revealing affairs with Woods, unraveling what had previously been a carefully protected public image of a happily married, disciplined, hardworking athlete. Woods eventually gave a public statement acknowledging that he had entered treatment, described at the time as treatment for sex addiction, a term that quickly spread through news coverage and public conversation surrounding the scandal. South Park's 14th season premiere aired on March 17, 2010, just a few months after this scandal first broke, taking direct aim at the entire cultural moment surrounding it. The episode imagines a version of America where this idea, sex addiction as a genuine, diagnosable medical condition, gets taken to its most extreme and most official possible conclusion. In the show's version of events, scientists connected to the Centers for Disease Control, a real federal agency responsible for tracking and responding to public health threats across the country, officially declare that sex addiction has become a disease reaching epidemic levels among the population. This detail matters a great deal, and it is worth slowing down to really sit with it. The Centers for Disease Control is not a fictional organization invented for the show. It is a real United States government agency, one that in real life tracks things like the spread of infectious diseases, food safety outbreaks, and other genuine public health emergencies. By placing this exact real agency at the center of its joke, declaring sex addiction a nationwide epidemic, the episode is drawing a very specific comparison. It is asking its audience to imagine the same kind of official, government-level seriousness normally reserved for something like a flu outbreak or a food contamination scare, applied instead to a wealthy, famous man's affair scandal. That gap between the seriousness of the response and the actual behavior being responded to is where almost all of the episode's comedy comes from. Once this fictional epidemic is officially declared inside the show, the response escalates quickly and dramatically. Schools across the country begin screening children specifically for signs of sex addiction, treating it the way a school might screen for a genuine contagious illness. At South Park Elementary, several of the boys, including Kyle, Kenny, and Butters, are put through this screening process and end up labeled as sex addicts, based on testing that, within the world of the show, is shown to be extremely vague and unreliable. One piece of research covering this episode describes the testing method used, showing children a suggestive image and judging their reaction, treating a completely unsurprised response as a warning sign of addiction rather than simple, ordinary awareness that comes naturally with growing up. This detail deserves attention because of what it reveals about how the episode is building its argument. The show is not simply making a joke about children being mistakenly caught up in an adult scandal. It is pointing directly at how loosely and how quickly official-sounding labels can be handed out once an institution has already decided ahead of time that a certain kind of epidemic exists and needs to be found. Once officials go looking for a condition using vague, poorly designed testing, they are almost guaranteed to find it in far more people than actually have any real, meaningful problem. This is not a subtle point the show hides beneath layers of plot. It sits right at the surface of the entire episode. One of the boys diagnosed during this fictional epidemic, Kenny, dies partway through the episode in a moment the show frames as a consequence of taking this entire manufactured panic seriously. Kenny attempts a dangerous act connected to his supposed condition while dressed in a costume, and it results in his death, continuing a long-running pattern throughout the show's history of Kenny dying in unusual, often darkly comedic ways within nearly every season. While this specific death is played largely for shock and dark humor rather than serious commentary, it still reinforces the episode's underlying point in a blunt way. Once a system decides, officially and publicly, that ordinary behavior counts as a dangerous disease, that decision can end up creating real, sometimes serious consequences for the very people caught up inside it, even when the underlying diagnosis was never built on solid ground to begin with. Following their diagnosis, Kyle and Butters are sent to a treatment center built specifically around this fictional condition, called the Carn Institute for Sex Addiction inside the show. Here, the episode takes one of its sharpest turns, filling this treatment center with a long list of real, named public figures who had, in real life, been connected to their own public scandals involving infidelity or sexual misconduct around that same period. The episode places characters representing Michael Douglas, Michael Jordan, football player Ben Roethlisberger, actor David Duchovny, actor Charlie Sheen, television host David Letterman, former President Bill Clinton, actor Billy Bob Thornton, basketball star Kobe Bryant, former politician Elliot Spitzer, and Tiger Woods himself, all inside this same treatment center alongside two ordinary elementary school boys. This choice of characters is not random or thrown together carelessly. Every single name on this list was connected, in real news coverage at the time or in earlier years, to a public scandal involving infidelity or sexual misconduct that had received heavy media attention. By gathering all of these real public figures into one fictional treatment center, the episode makes a very direct visual argument. It is showing all at once just how large and how frequent this pattern of celebrity and public figure scandal actually was during this period of American culture, while simultaneously questioning whether grouping all of these very different situations under one single medical label, sex addiction, actually made sense, or whether it mainly served as a convenient, less embarrassing explanation for a wide range of very different personal choices and behaviors. The episode does not simply present this treatment center as a neutral, helpful place either. Instead, it shows the center focused far more on managing public image and legal consequences than on genuinely helping anyone examine or change their own behavior. Rather than teaching real strategies for self-control or honest reflection, the treatment shown inside the episode centers mainly around how to avoid getting caught in the future, treating the real problem not as the behavior itself, but as the exposure and embarrassment that followed getting caught. This detail lines up directly with a broader question that was being genuinely debated in real medical and psychological circles around this same period, whether sex addiction should be classified as a true diagnosable medical condition at all, or whether the label was being used more as a public relations tool by wealthy, famous individuals looking for a softer, more sympathetic explanation for choices that were, at their core, simply personal decisions rather than symptoms of any recognized illness. Running alongside this main storyline, the episode builds a second, equally pointed thread involving scientific research meant to explain why so many wealthy, successful men seem to be engaging in this behavior. Scientists within the show conduct experiments using chimpanzees, testing whether access to large amounts of money changes behavior in ways that mirror what they were seeing among the human public figures caught up in these scandals. The show pushes this joke toward an especially memorable and pointed conclusion, when scientists notice that an image of a real historical building, Independence Hall, appears on the back of a $100 bill, and jump to the exaggerated conclusion that the origins of this so-called addiction can somehow be traced back to that very building. This part of the plot is clearly meant to be absurd rather than realistic, but the joke buried inside the absurdity is not hard to identify. By connecting money itself, symbolized through American currency, to this supposed epidemic of infidelity among wealthy and famous men, the episode is making an argument that sits just below the surface of its more ridiculous plot points. Wealth, fame, and power create opportunity and access that ordinary people simply do not have. And the episode suggests that this access, not some newly discovered disease spreading silently through the population, is the far more believable explanation for why so many rich and famous men kept ending up in nearly identical scandals around this same period. Eventually, the show's plot spirals into an even more exaggerated direction, introducing a fictional alien creature blamed for spreading this so-called addiction across the country, something clearly meant purely as comedic escalation rather than any kind of serious commentary. This part of the episode does not carry the same real-world weight as the earlier scenes involving diagnosis, treatment, and the CDC declaration. It functions mainly as the show's typical style of pushing a story toward its most chaotic, most cartoonish possible conclusion once the underlying argument has already been made clearly enough. What makes sexual healing worth including inside this larger conversation about South Park and American healthcare is not really its plot about aliens or its exaggerated chimpanzee experiments. It is the underlying pattern the episode identifies, one that connects directly back to nearly every other episode already covered in this video. Throughout this entire special and throughout this entire video, one theme keeps repeating itself in different forms. Institutions, whether they are insurance companies, pharmaceutical companies, food companies, or in this case, government health agencies and media-driven public opinion, hold enormous power over what gets officially recognized as a real medical condition deserving treatment, and what gets dismissed instead as simply a personal choice or a character flaw. Sexual healing takes this exact question and flips it in a slightly different direction compared to the other episodes discussed so far. Rather than showing someone with a genuine medical need being denied treatment, as seen with Cartman in The End of Obesity, this episode shows something being labeled a medical condition that may not have deserved that label at all, driven less by careful science and more by a very public, very embarrassing celebrity scandal that needed some kind of official-sounding explanation. This connects to a real and ongoing conversation that has continued inside the medical and psychological community long after this episode originally aired. Sex addiction, sometimes also referred to using other clinical-sounding terms, has never been formally recognized as an official diagnosis inside the primary manual used by mental health professionals in the United States to classify recognized psychological disorders. This absence of formal recognition does not mean nobody has ever struggled with genuinely compulsive, harmful sexual behavior that negatively affects their life and relationships. Many mental health professionals agree that a smaller group of people do experience something real and serious that deserves genuine treatment and support. But it does mean that widespread public use of the term, especially in celebrity scandals like the one satirized in this episode, has often stretched far beyond anything backed by consistent, formal scientific agreement, closer to a convenient public explanation than an established medical diagnosis. This gap between what the public casually treats as an official medical condition and what the medical and psychological community has actually agreed upon through careful research sits at the very center of what makes this episode still relevant, well beyond the specific Tiger Woods scandal that originally inspired it. The episode uses one particular celebrity story as its entry point, but the underlying question it raises reaches much further than golf, infidelity, or any one famous person's personal choices. It asks something that connects directly to every other episode already covered in this video. Who actually gets to decide what counts as a real disease, deserving real treatment and real sympathy? And what factors, whether scientific evidence, public embarrassment, financial interest, or simple convenience, actually drive that decision in practice? Looking back at this episode from years later with a much clearer public understanding of how genuine mental health struggles are properly diagnosed and treated, Sexual Healing holds up as an unusually sharp piece of commentary, made all the more interesting by how early it arrived. Long before the end of obesity dramatized a system deciding who deserves coverage for a real, medically recognized condition, Sexual Healing had already explored the opposite side of that same coin, a system quickly agreeing to officially recognize a condition that may never have deserved that recognition in the first place, largely because doing so was more convenient, and in some cases more profitable, for the powerful people involved than simply admitting to a personal choice. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. This episode closes out the part of this video focused on how institutions decide what counts as a real medical condition worth treating seriously. From here, the story shifts towards something no institution, no insurance company, and no pharmaceutical company could control or spin in quite the same way. A real virus that spread across the entire world, and the season of episodes South Park built specifically around trying to survive it. Section 9, the Pandemic Special, Systemic Breakdown. In early 2020, something arrived that no insurance company, no drug maker, and no cereal mascot could have planned for. A virus that spread across the entire world within a matter of months, shutting down schools, businesses, and daily life almost everywhere at once. South Park did not wait long to respond. By September of 2020, the show had already produced a full hour-long special built entirely around this event, called the Pandemic Special, and it stands as one of the fastest, most direct pieces of comedy ever made about a health crisis while that crisis was still actively unfolding. To understand how unusual this timing actually was, it helps to think about how television normally works. Most shows need months, sometimes years, to write, animate, and release new material. A comedy responding directly to a major world event usually arrives well after the initial shock is already passed, once writers have had time to process what happened and figure out how to make sense of it. South Park did the opposite. The virus reached the United States in early 2020. Widespread shutdowns, school closures, and mask requirements began spreading across the country through the spring and summer of that year. By September, less than a year after the virus first became a serious concern in America, South Park had already built and released a full-length special addressing it directly, while the pandemic itself was still very much ongoing, with no vaccine yet available to the public and no clear end in sight. The special opens by showing just how much daily life in the town has changed. Butters, one of the show's younger and more innocent characters, is shown desperate to visit a children's toy and stuffed animal store that has recently reopened after being closed for months. His parents refuse to take him, explaining that the store counts as a non-essential business, meaning it is not considered important enough to justify the risk of going out during a period when public health officials were still urging people to avoid unnecessary trips outside their homes. This small, simple moment captures something that millions of American families experienced firsthand during this exact period. Parents having to explain to confused, disappointed children why ordinary places they used to visit freely, arcades, toy stores, playgrounds, were suddenly off limits, not because anything about the location itself had changed, but because of a danger too small to see with the naked eye. From this opening scene, the special widens its focus to look at how the adults of the town are handling the same restrictions. And this is where one of the episode's sharpest and most specific pieces of commentary appears. Butters' father, a character named Steven, is shown criticizing people in town for wearing their masks incorrectly, specifically calling out people who pull their mask down below their nose and mouth, letting it rest around their chin instead. He describes this improper way of wearing a mask using a memorable and pointed phrase, calling it a chin diaper. This detail is worth pausing on because it reflects something that was genuinely happening across the country during this exact period. Public health officials spent enormous amounts of time and effort during 2020, specifically explaining and re-explaining how a mask actually actually needed to be worn to provide any real protection, covering both the nose and the mouth completely, because a huge number of people were wearing masks incorrectly, often without realizing that a mask worn below the nose provides essentially no meaningful protection at all. The show is not inventing a strange, exaggerated joke here. It is capturing a real, widely reported point of frustration and confusion that public health messaging struggled with throughout this entire period. The special also directly includes a version of Dr. Anthony Fauci, a real government health official who became one of the most publicly recognized figures in America during the pandemic, because of his role advising the country on how to respond to the virus. In the episode, this character appears on television giving public health advice, specifically about how to properly wear a mask, delivered in the exact kind of calm, matter-of-fact tone real television viewers would have recognized from his frequent real-world appearances throughout 2020. Including a real, still-living public health official as a character says something about how directly the special was willing to engage with the actual events unfolding in the country, rather than inventing a fictional stand-in character to deliver similar advice from a safer distance. Running alongside these mask-related jokes is a second, much larger storyline focused on Randy Marsh, the father of one of the show's main characters, Stan. Randy owns a marijuana farm called Tegrity Farms, a business the show had already been developing across earlier seasons. In this special, Randy is shown gloating that sales at his farm have gone up by 400% since the shutdowns began in March, while many other businesses around town have been forced to close down entirely. This detail lines up with something that was genuinely reported in real economic coverage of the pandemic. While countless small businesses across the country, especially ones relying on foot traffic, dining, or in-person entertainment, suffered enormous losses or closed permanently during 2020, certain other businesses, including some connected to at-home entertainment, delivery, and recreational products, actually saw a noticeable rise in demand as people spent far more time confined to their own homes. Randy's storyline captures this real, uneven economic pattern in a simple, exaggerated way, one family profiting handsomely while an entire town around them struggles. Randy names his new, especially strong product the Pandemic Special and begins selling it publicly to a crowd gathered in the town square. His wife Sharon becomes furious with him over this decision, accusing him directly of trying to profit off other people's suffering during a genuine public health crisis. This confrontation matters because it introduces the emotional core that runs underneath the entire special. Randy is not written simply as a greedy businessman capitalizing on hard times without any guilt attached to it. As the episode continues, it becomes clear that Randy is carrying a much heavier secret, one connected directly to how the virus itself began, and this secret slowly eats away at him throughout the special. Through a series of flashbacks, the show reveals that Randy was personally responsible, in the show's fictional version of events, for the virus jumping from animals into humans in the first place, tracing back to an earlier trip he had taken to China. This storyline plays out through an increasingly absurd series of events involving Mickey Mouse and different animals, culminating in the reveal that scientists have identified a pangolin rather than a bat as the animal connected to the outbreak's origin. This part of the plot is clearly built for shock and dark comedy rather than realism, but it is worth noting that pangolins were in fact a real animal discussed by actual scientists and researchers during 2020 as one of several possible links in how the virus may have originally moved from animals into the human population, alongside bats. The show did not invent this animal out of nowhere. It picked up on a detail that was genuinely part of ongoing scientific investigation and public conversation happening in the real world at the exact time this special was written and released. Randy's guilt over his role in starting the outbreak becomes one of the special's most consistent threads, showing him wandering through town, watching the damage being done all around him, and struggling with whether to admit what he has done. At one point, a grieving man approaches Randy and thanks him personally for the Pandemic Special product, explaining that it has helped him cope with losing his wife to the virus. Rather than feeling proud of this thanks, Randy is overwhelmed with guilt and runs away from the conversation entirely. This moment captures something the special returns to again and again in different forms: the uncomfortable and complicated relationship between profiting from a crisis and genuinely wanting to help people get through it. Two things that do not sit easily together, even when the same product happens to be doing both at once. While Randy's storyline plays out, the special shifts its focus toward the town's elementary school and the very real, very difficult question of how schools across the country were supposed to safely reopen during an ongoing pandemic. Mr. Mackey, the school counselor, holds a meeting with parents over video call, explaining that children will be returning to in-person classes. This detail mirrors a real and heavily debated question facing school districts across the entire United States throughout 2020: whether and how to bring students back into physical classrooms while the virus was still actively spreading, with no vaccine yet available and significant disagreements among health officials, parents, and teachers about how much risk reopening actually carried. The special pushes this storyline into darker territory once the town's regular teachers refuse to return to the classroom, citing safety concerns about the virus. In their place, the school hires the town's police force to serve as substitute teachers, an unusual and pointed choice that connects directly to a second major news story dominating headlines throughout 2020, alongside the pandemic itself, nationwide protest, and public debate over police funding and police conduct, sparked by real, widely reported incidents of police violence that occurred that same year. By having police officers, rather than trained educators, take over the classroom, the special blends these two major news stories together into a single storyline, showing a school environment that begins to resemble something closer to a detention facility than a place of learning, with kids given only short amounts of time to video call their parents and tightly controlled, staggered meal times. This part of the special drew specific attention from television critics at the time for how directly it tied these two separate crises together. One review described the special as targeting a wide range of real issues at once, including aggressive police behavior, alongside racial tensions and unrest connected to the police violence protests happening throughout that year. This connects to something explicitly stated in the special's own plot description, that the episode intentionally addressed police brutality and racial unrest as part of its broader commentary on 2020, treating these issues as inseparable from the pandemic itself rather than as a completely separate topic layered awkwardly on top of it. As conditions inside the school worsen, one of the show's core characters, Stan, is shown suffering a visible nervous breakdown, overwhelmed by the accumulated stress of watching his friend Butters struggle emotionally under the school's strict lockdown-style rules, unable to do anything as simple as visiting a toy store that had reopened months earlier. This moment stands out because Stan is normally one of the show's calmer, more level-headed characters, rarely shown losing control emotionally the way this scene depicts. His breakdown functions as a kind of stand-in for the emotional toll the pandemic placed on children and teenagers specifically, a group whose mental health struggles during this period were widely documented by real researchers and pediatric health organizations studying the effects of prolonged isolation, disrupted schooling, and ongoing uncertainty on young people across the country. Determined to help Butters, Stan organizes the other kids at school to break out of the building entirely, so Butters can finally get his long-delayed trip to the toy store. This escape plan leads the special toward its most chaotic sequence, as news of children escaping quarantine spreads through the town, triggering panic among parents and residents already on edge from months of uncertainty. This panic quickly spirals into scenes of rioting and looting breaking out across South Park, which the special uses as justification within its own fictional plot for the police force to have their funding and equipment restored after previously losing much of it earlier in the episode, due to public backlash over police violence. By the end of the special, very little has actually been resolved in any clean or satisfying way. Wildfires, an additional real and widely reported crisis that struck parts of the western United States during 2020 alongside the pandemic, are shown breaking out across the town, pushing South Park into an extended lockdown with no clear end date. Randy comes close to finally confessing his role in starting the outbreak to his wife Sharon, but the special ends on a strange, unresolved note instead, choosing not to deliver a clean, comforting conclusion the way many television specials might. This lack of a tidy ending drew specific comment from critics reviewing the special at the time, several of whom noted that the episode's chaotic, unresolved conclusion actually matched the real, ongoing uncertainty everyone watching was still living through in September of 2020. There was no vaccine yet, no clear timeline for when schools, businesses, or daily life might return to anything resembling normal. By refusing to hand its audience a neatly wrapped ending, the special mirrored the genuine, shared uncertainty sitting outside the television screen just as much as inside it. Looking back at everything covered inside this single special, mask confusion, business closures hitting some industries harder than others, school reopening debates, police funding controversies, and the emotional toll all of this placed on children specifically, it becomes clear that the show was not simply making jokes about wearing a mask incorrectly or staying home from a toy store. It was attempting something far more ambitious, capturing an entire chaotic year of American life, spanning public health, economics, education, and civil unrest inside a single hour-long piece of television, produced and released while that same chaotic year was still actively unfolding around its own writers and audience. Before we move on, if you're enjoying this analysis, please consider subscribing. It helps the channel tremendously. The pandemic special captured a virus with no vaccine and no end in sight. That would not stay true for very long. Within months, a vaccine did arrive, and getting access to it turned into its own complicated, deeply unequal story. One South Park picked up again almost immediately in its very next episode. Section 10, the vaccination rollout and Kyle's verdict. By March of 2021, the world had reached a very different point than where the last special left off. A vaccine now existed. Multiple companies had developed one, tested it, and received approval to begin giving it to the public. This should have felt like the beginning of the end of a very hard year. In many ways it was. But getting an actual dose into an actual arm turned out to be its own complicated story. And South Park picked this story up almost immediately with a new special called South Park Q Vaccination Special. The special centers on the very real, very specific situation many Americans found themselves in during the early months of 2021. Vaccines had arrived, but there were not nearly enough doses to give everyone at once. Health officials across the country had to decide who would receive the vaccine first, and the general approach chosen nationwide prioritized older adults and people working in essential jobs, meaning workers whose roles were considered too important or too high risk to wait, such as healthcare workers, teachers, and certain other frontline positions. Everyone else had to wait their turn, sometimes for weeks or months, watching the news for updates on when their own age group or job category might finally become eligible. South Park captures this exact moment through Mr. Mackey, the school counselor, and another staff member, Thomas Adler, who are shown desperately trying to get vaccinated so they can safely return to teaching in person again. They travel to a Walgreens pharmacy, a real well-known chain of drugstores that served as one of the actual distribution points for vaccines across the country during this period, and find a long line of people already waiting outside. When they try to join the line, they are turned away, told that only senior citizens are being allowed inside that day. This scene, ordinary people showing up hopeful and being told they simply do not qualify yet, mirrors something reported constantly in the news throughout early 2021. Confusion and frustration around exactly who was eligible on any given day at any given location, often changing from one week to the next as supply shifted. One especially memorable moment in this scene shows an elderly woman leaving the pharmacy after successfully getting her vaccine, looking out at the crowd of people still waiting outside, and bluntly announcing her success before walking away. This small moment captures something real about how vaccine access created a strange kind of visible divide in communities during this period. A divide between people who had already gotten their shot and people still waiting anxiously for their own turn, sometimes standing right next to each other outside the same pharmacy. The plot inside the school becomes just as pointed. Margaret Nelson, one of the teachers, is humiliated by a prank pulled by Cartman and Kenny and ends up quitting on the spot. In the process, it is revealed that she had not yet been vaccinated, something she had apparently kept quiet. This detail reflects a real tension playing out in actual school districts at the time, where many teachers were understandably nervous about returning to a classroom full of children before having a chance to get vaccinated themselves, since the youngest age groups were among the last to become eligible. Her sudden departure creates an opening filled by former President Garrison, a recurring character in the show who had spent the previous several seasons portraying a version of a sitting American president. With his term now over, Garrison returns to South Park to resume his old job as a teacher, stepping back into ordinary small-town life after years away in national politics. His return is met with open hostility from much of the town, who remain deeply unhappy with decisions made during his time in office, particularly around how the pandemic itself had been handled at the federal level in the show's earlier storylines. Garrison's only real support comes from a family in town led by a character named Bob White, along with a group of followers connected to QAnon, a real conspiracy theory movement that had grown rapidly across the United States during this exact period, spreading largely online and gaining national attention for its influence on segments of the public during 2020 and 2021. The special uses this storyline to satirize how vaccine misinformation and conspiracy theories were spreading at the same time real vaccines were being distributed, showing the White family specifically pushing the false claim that vaccines were secretly being used to track people, a real, widely reported, and thoroughly debunked rumor that circulated online during the actual vaccine rollout. This storyline escalates into the White family attempting to recruit children at the school into these same beliefs, treating the vaccine as something dangerous and secretly controlled by hidden elites, rather than a tool meant to end a genuine public health crisis. The special does not treat this misinformation gently or as a harmless side joke. It shows real consequences tied to it, weaving this thread through the entire episode as a serious obstacle standing between the town and any real path back to normal life. A quieter but equally important storyline runs alongside all of this, following Stan, Kyle, and Cartman as their friendship becomes strained under the accumulated pressure of the pandemic. Their fourth friend, Kenny, is left feeling increasingly excluded as the other three become consumed by their own scheduling conflicts and personal frustrations, mirroring something real that mental health researchers documented broadly during this period. The way prolonged isolation and disrupted routines place genuine strain on friendships and relationships, even among people who had known each other for years. By the end of the special, Garrison manages to negotiate a large shipment of vaccine doses for the town, arriving by plane, finally allowing the school's teachers to get vaccinated and the school to reopen more safely. This resolution captures the moment vaccine supply across the country genuinely began to catch up with demand later in 2021, though the special is careful not to pretend this fixes everything instantly. One storyline ends on a genuinely somber note when Mrs. Nelson, the teacher who had quit earlier in the episode, is shown having contracted the virus and passing away after returning to town. A stark reminder woven into an otherwise comedic special that the stakes behind all of this satire were never actually a joke. Taken together, these two specials, the one covering the earliest days of lockdown and this one covering the vaccine rollout, form a kind of two-part record of exactly how the pandemic unfolded in America, built and released while it was still happening, capturing the confusion, the uneven access, the misinformation, and the real losses experienced by real families, all wrapped inside a small mountain town that had already spent decades absorbing whatever the rest of the country was going through. With the vaccine special closing out this video's look at COVID, it is worth stepping back and looking at everything covered across all 10 sections together, because one moment from earlier in this video ties the entire argument together more clearly than any single episode on its own. Inside the end of obesity, after everything Cartman and his friends have been through, Kyle stands in the middle of the school cafeteria and delivers a short, plain-spoken monologue that functions as the closest thing this entire body of work has to a final verdict. He admits that he used to believe people struggling with their weight simply needed more willpower, but says that after everything he witnessed trying to help Cartman, he no longer believes that. He states directly that there are sugar companies, pharmaceutical companies, and insurance companies all separately trying to find ways to make money off of people's health, and he asks how anyone is supposed to have enough willpower when forces like that are working against them every single day. This single monologue reaches back across every episode covered in this video. The insurance office that decided a claim's fate with a rotary phone call, the real prior authorization system that doctors have publicly described as more about delay than safety, the national survey showing 2 out of 3 already sick, insured adults running into real obstacles getting care, the sugar industry's documented history of quietly funding research to protect its own profits, the opioid crisis built and fueled by companies that pushed painkillers onto doctors and patients alike, a sex addiction epidemic invented almost overnight because it was more convenient than admitting to simple personal choices, a pandemic that exposed every crack already sitting inside the country's schools, workplaces, and public trust, a vaccine rollout that showed once again how unevenly access to basic healthcare gets distributed even during a genuine emergency. None of these are separate, unrelated stories. They are chapters of the exact same argument told across nearly 3 decades by 2 writers who kept returning to the same basic question again and again. Who actually benefits when Americans are sick, confused, or scared? And who is left standing alone trying to get help from a system that was never really built with them at the center of it? South Park never claimed to have the answer for how to fix any of this. What it did, patiently, episode by episode, decade by decade, was keep pointing directly at the question, refusing to let it quietly disappear into the background noise of everything else going on in the news. If you enjoyed this video essay, make sure to subscribe. Thanks for watching, and I'll see you in the next one.